Hi once again. Uh, we will now be on lecture 9E, I do believe. And we're going to finish up a little bit of brain injury, some information that I did not share with you when we finished up TBI, partly because of the length of the lecture and knowing how long it takes to upload. So we will finish the information in chapter 9, the PowerPoint. And then what we'll do is the next lecture will be over Fragile X. Now remember, Fragile X is not in the PowerPoint. It is not part of the textbook. What it is supplemental information. So you definitely will want to take notes. You will want to jot some information down so that you can review that in preparation for the final. Now, I have uploaded the information on Fragile X. Don't freak out by the information that's there. You're not going to be expected to know all of that information. It will be for your resources. That's what a lot of that is for you to take away and review, keep, make sure that you have it for a later time as you progress in your career. So, if you watch the video, and that video that I have listed for you on Canvas is Living with Fragile X, My Perfect Family. Please view that video before you tap into the lecture on Fragile X. Okay? All right, let's get started. As you know, we talked about TBI, or traumatic brain injury, and there is also another type of injury that can happen in the brain. It's called a CVA, or cerebrovascular accident. And that CVA is another cause of brain injury. I'm going to move my chair over a little bit so that, yeah, that window behind us is a little bright, isn't it? Sorry about that. It's another kind of brain injury. And this brain injury is what interrupts the blood flow to your organs as well as to the brain. The results can be mild, they can be serious. It will depend on the type of damage that an individual gets. It will depend on how long it takes from the CVA until they get some medical care. It will depend on other medical conditions that the individual has. It will depend on their age as to mild or severe. Now, you may typically think of your grandparents who have had CVAs, and certainly it is something that does occur within the geriatric population. And we know that it impacts your ability to swallow, to chew, to speak, to use your extremities, your hands. It impacts your ability to walk. It can have lasting deficits. And I would say for most individuals after having a stroke, there will be some maybe mild deficits, but there is a wide range of what can happen. Now, also, I want to remind you, and maybe you haven't thought about this, but infants can also have a stroke. Think about the definition. It's a brain injury that interrupts the blood flow to the brain. They can have a stroke in utero as a fetus. They can have a stroke during the birthing process as the infant moves down the birth canal. They can have a stroke, CVA, cerebral vascular accident, I'm using those words synonymously, Also, at a year old, at 2 years. Many times, if it's a preemie and there is a stroke, think about the condition of that preemie, and having a stroke could, the outcome maybe isn't going to be good, because infants, there is a certain percentage of infants that will die after having a stroke. But strokes happen in infants, toddlers, teenagers, adults, and the geriatric population. It's just not us old folks that it happens to. And I would suspect that many of you have family members who have had a stroke. So we know that it does happen in the geriatric population as well as in infants and children. One thing that I will say about cerebrovascular accidents, or these CVAs, is that if a child has a CVA, remember brain plasticity, and that brain plasticity works in the individual's favor. That brain plasticity facilitates healing and different parts of the brain potentially taking over, and the healing process is better. Rehab may be better given the circumstances. Now you have to keep that in mind. Older individuals who've had a stroke may suffer from other conditions that their rehabilitation isn't quite as extensive. Now, you have to keep in mind that after the individual has had the stroke, they're going to need rehab. Now, that rehab could be occupational therapy, physical therapy, speech therapy. It could be that they live in a remote area and they're not able to get to the hospital, the nearest hospital, where they can get rehab. They may not have a family member who can take them because they're unable to drive. So the amount of rehabilitation, the age of the individual, and the time span between when they had the stroke or CVA until they were able to get treatment, those are all factors that play into that. And we do know that there are lifelong consequences and deficits as a result of a stroke. The risk factors for a stroke include a congenital heart disease. I'm talking congenital. We know individuals who are very physically fit, they have fabulous diets, they exercise, they're in really great shape, and they have a massive heart attack. That's a genetic indicator that the heart attack was family related potentially. But their healing process, their rehab may be quicker too because they are physically fit. On page 165, it does mention learning disabilities a little bit, but I feel like we've talked about that. We know that individuals with a learning disability have normal intelligence. The brain is processing information differently in language. They may see the resource teacher. Hopefully they get some help so they don't follow through the cracks at school. We don't want them to be chronic failures. So we're going to move past that. Now on page 166, I just want to talk a little bit about specific language impairment, or SLI. You probably won't see this diagnosis too often because many times it's labeled as a learning disability. But it is a language disorder. But it's not a language disorder from a hearing loss. It's not due to low intelligence. It's not due to motor delays, although we know motor delays do impact language development. It's uneven development of language. And one of the examples that it has in the PowerPoint is the individual may have a delay of 2 years in vocabulary, but the grammar or the syntax may be delayed 3 years. You would expect that maybe that delay was closer together. So they have uneven development. But you'll probably see it labeled a learning disability more often than you're going to see specific language disorder or specific language impairment. SLPs might be a little more inclined to see that diagnosis. Phonological disorders we have touched upon. You know that it can include articulation disorders where there are substitutions of one sound for another. Could be a distortion. It could be an omission of final consonants, something of that sort. But the phonological disorder can even go deeper and show up more as phonemic awareness, more like dyslexia as the child experiences difficulty decoding words. Now remember, a child who's in the lower elementary grades will learn to read. As we get into that 3rd grade, 4th grade, 5th grade, these kiddos are reading to learn. And many times that's when we see them come into the clinic for a diagnostic. They had some trouble with letter sound association, had a little trouble learning the alphabet. Reading has been a struggle. They haven't made a lot of progress. And so they get help in the classroom. They may have an aide. They may have a parent who comes in and helps children in the classroom with things like reviewing spelling words or reviewing reading and things of that sort. But when we get to the 3rd grade, those kiddos many times are expected to be more independent, and that reading to learn really shows up. Their grades begin to fall, and parents are like, what happened? He was doing fine in the 1st grade and the 2nd grade, and we get to the 3rd grade and the grades have plummeted. Well, the language load increases, and the expectation is that they be more independent. And they struggle. They just simply don't have the foundation. We do have, as we've talked about voice disorders, probably the biggest voice disorder or the most common one that you will see in the classroom in an educational setting would be a child whose voice quality is very hoarse. And I call those kiddos the screamers. There is the 4th child in a family, the youngest, and they really have to make their voice heard. And so they're talking really loud, and they're playing and they're screaming, and their voice is really loud. They are abusing the vocal cords, the vocal folds. We see it in the theater department. Sometimes we have theater majors come in for voice therapy because they are abusing their voices. They're preparing for a play. They are also singers, and they have voice lessons. And then they go outside and they give tours for our new students coming in. And that vocal abuse just takes over. You can't continue to abuse your vocal cords and not pay the price. And it's usually hoarseness. Teachers sometimes, they're at the end of the day, they can barely speak. Their voice fatigues. Some of our professional singers, you may have read information about Keith Urban, who had, I don't know if he had nodules, but he had to put into place vocal rest. And that is one of the strategies that speech pathologists and ear, nose, and throat doctors will recommend, is that rest that voice, no talking. Increased hydration, drink more, you've got to hydrate them. You may remember as an adolescent being at the basketball game, the football game, and you yell, and by the end of the night you can barely speak. Vocal abuse. So our kiddos are hoarse or breathy. Now, you would then make a referral to the speech pathologist, who will then contact the family, and it is a medical condition, and they would be referred to a doctor. That's the only one I want to mention there. Organic voice disorders, some pathology that causes the voice disorder would be cancer of the larynx, congenital abnormalities, contact ulcers, and cysts on the vocal folds, infectious laryngitis, or constant reflux, or you may have heard it called GERD, gastroesophageal reflux disease. And that reflux, you're bringing up stomach fluid, and it's very potent and powerful and toxic, and it's coming up and could be burning the esophagus a little bit, but it comes up to the level of the vocal folds and can be a very strong irritant for the vocal folds. And of course, that's a medical condition. Another condition that we see sometimes is we have talked about cranial nerves and what cranial nerves do for us. The largest cranial nerve is cranial nerve 10. It's the vagus nerve. And if you have vocal fold paralysis of one fold, you have, remember the two that are together, if one of them is able to move back and forth, but the other one stands still, it doesn't move, then you're not going to get good closure of those vocal folds, and that you're going to sound breathy. Your voice is going to sound harsh. So vocal fold paralysis almost always involves the vagus nerve or cranial nerve number 10. There are some voice disorders that go along with the CVA, the stroke that we just talked about, and some of those are dysarthria. You don't usually see stuttering after a stroke, but you could certainly have some dysarthria. Motor movement, the motor movement is impacted. Fluency disorders, what you need to remember about that, normal fluency is demonstrated between the ages of 2 and 6. The child may hesitate, may prolong, may repeat syllables and or words. If in your transcriptions on your projects, some of you had children who would say something like, well, well, yeah, I think that's okay. They repeated 2 or 3 words, but there was no tension in the neck, the lips, the face. You did not see them be bothered, particularly by their repetitions. It's like they were thinking about what they wanted to say, and then they stopped, and then they thought, well, maybe I should say this first, and then go on, and then they're able to finish. There's no avoidance and no signs of struggle. If it's prolongation, they're prolonging an initial consonant, or it could be a word. The hesitation may be getting started is difficult. They may have more problems with an initial consonant, and they will avoid words that start with that initial consonant. I had a young man that I worked with, and he had difficulty saying his name. He could not say words that started with B, and his name started with a B. So he always struggled with saying his name. And that was one thing that we worked on early. So within this fluency, we're looking for struggle, avoidance, anything that is unusual about the way the child is beginning to speak. We know stuttering is more prominent in males than females. And as stuttering or repetitions start out, they're very easy, and you just ignore them. If the child is beginning to be more aware that they're having trouble talking, it would be best to avoid asking them to speak during times of anger, if they're sick, if they're upset, if they're tired. Choose those situations carefully. avoiding asking the child to perform in front of grandparents, things like that that would cause additional anxiety. Also, there is another fluency disorder called cluttering. And cluttering sometimes accompanies stuttering. But the difference between stuttering and cluttering also has a language base to it. They have language disorders along with the repetitions. Their speech is very rapid. They seem to speak in bursts of words, phrases, or sentences. It does exist with an articulation and or a language disorder. Sometimes the voice is monotone. Sometimes there's some mumbling. There may be some hyperactivity, short attention span that goes along with it. But with cluttering, you have a language deficit that goes along with it as well. Okay, I think that finishes up the PowerPoint in Chapter 9. Now what will happen is later today or tomorrow, I will cover Fragile X. Please, please, please watch the video because it will make so much more sense, the lecture, and you'll understand why I want to cover this topic with you. So please watch that. So I'm going to sign off now, and I will upload the end of Chapter 9 for you. And then I will see you for the lecture on Fragile X, and then we will do a review. See you later.